New Zealand's health system is already struggling with a staffing crisis. Now it faces another big threat, temptation from Australia. Kiwi nurses who have already crossed the ditch say they're now earning 3 times what they did here.
New South Wales has just announced its biggest ever boost, $4.5 billion to recruit 10,000 more staff, many of whom will be New Zealanders. Juliet Speedy reports.
Thousands more Kiwi health workers may soon be on board these flights crossing the ditch. Australia is hungry for healthcare workers. New Zealand is a prime target, but already facing its own staffing shortage.
It's a crisis out there. It's really concerning.
And the recruitment drive from New South Wales puts extra pressure on the government.
We've got a real threat with investment across the ditch into a health workforce, and we've got a frailing system at the moment that is under-resourced. The government has to decide what it's going to do.
We're already seeing, with the borders open, that there's been some movement. We're very aware that midwives have been, some are poised to go, and so it's already happening. And I think with a deliberate campaign, we're likely to see more.
Australia's new Prime Minister has already said he wants many more health staff, and now New South Wales has announced an unprecedented $4.5 billion package to recruit more than 10,000 doctors, nurses and other health staff.
An acknowledgement about the need to invest in people.
Want to come and listen to baby?
Nurses, midwives and the aged care sectors are among a few already significantly short-staffed here. They're also sectors that can easily register to work in Australia, where they'll earn more.
The recruitment packages that are on offer appear to be very, very attractive and very favourable.
We spoke with one Eddy nurse here considering resigning soon to head for Australia. Her Kiwi colleagues over there are encouraging her to. Some are being paid triple what they were getting here in New Zealand. She said it's not just the money but a feeling of burnout and enormous pressure at work here due to the lack of staff.
It won't take much for those nurses just to walk away.
The government put $11 billion into the sector in the last budget, and Health Minister Andrew Little said NZNO walked away from a fair pay offer late last year.
The hospitals and the government are doing everything we can to increase recruitment and to increase remuneration. The nurses' organisation is not playing its part.
Little also says Australia has a bigger need.
The Australian system, particularly in New South Wales, was hugely understaffed. That was why their health system was overwhelmed during the COVID outbreak.
The nurses' organisation says there is actually a global shortage of health workers, and if New Zealand nurses aren't looked after, they'll head offshore, and ultimately more Kiwi patients will suffer. Juliet Speedy, Newshub.